Hi everybody, I'm Victor Brick, and welcome to today's Road to 100 Fit Tip, how to reduce knee pain. We're here on the Bondi to Bronte walk. We're in Sydney, Australia, and we're about to do a walk from Bondi Beach, the world famous Bondi Beach, along the coastline, this very narrow walk, as you see as it fades off to my left, all the way to Bronte Beach. That's not Bronte Beach there, by the way. We're going to walk along those cliffs all the way around that point to a little beach called Bronte, where we're going to eat at the Swell Bar. Our friend Sandy owns a nice little bar there, a nice little cafe, really. We're here in Sydney, Australia. We presented at a fitness convention, and we went to a health retreat owned by our great friend Tony DeLead. And now we're staying in Tony's place on Bondi, visiting with friends, getting ready to go back to the United States. It's actually Easter Sunday, so happy Easter, everybody. Now, I can tell you, today's fit tip is how to reduce knee pain. I can tell you that my knees are as bad as anybody's. If you look at my knees, first off, you notice that my legs look like I've had a bad case of scurvy my entire life. But I also had a knee injury from basketball when I was in the 70s, 1971. Operation, you see how my knee caves in, and nobody has experienced more back pain over the years than myself. And we're about to do roughly a 2 to 3 mile walk along the coast, up and down some pretty steep inclines. And I've been doing this for the last 2 weeks, and my knees have never felt better. And one of the things that I had forgotten, I was reminded when I went up to Gwingana, is that connective tissue. And of course, most of the pain in a knee is skeletal and connective tissue, ligaments and tendons and bone, still have a blood supply. And if you warm up the knees and increase the blood supply to that area before you begin your activity, it's going to feel a lot better while you're doing it, and it's also going to perform a lot better so that you have less pain after. So here's an exercise you should do every day if you have knee pain, if you have swollen knees, if you had an operation, if you had bursitis, arthritis. Just put your feet a little closer than shoulder width apart, put your hands on your knees, and simply rotate them 10 times in a circle. 3, 4, 5, 6, 7, 8, 9, 10, and reverse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You'd be amazed how much better your knees will feel just with that simple little exercise. One other suggestion, while you are walking, make sure you roll through the ankles, because the ankles are your first shock absorber. If you lock the ankles, a lot of people with bad knees, like myself, would lock the ankles and plod along trying to protect the knees. And what you're really doing is sending the shock of the ground up through the ankle to the knee. So I've been really consciously rolling through my ankles, and I'll tell you, I've been walking sometimes 4 miles, sometimes up some pretty steep inclines at a pretty rapid pace, and I've never felt better literally in the last 5 to 10 years. So that's it for today's fit tip. If you enjoyed this fit tip, please feel free to pass it on to a friend or family member. We'd love to hear your comments. You can use a suggestion below. And for a text version of this fit tip, or for past fit tips, or Uncle Vic's, you can visit our website at www.brickbodies.com. Because we're here in the ocean, and of course Australia is known for a lot of dolphins, I'm going to give you that old corny old dolphin joke, and that is, did you hear about the dolphin who lost his best friend? Seems he no longer had any porpoise in life. I told you it was corny. Until we meet again, see you at 100 years, that is.